Menstruation is a natural fact of life and a monthly occurrence for the 1.8 billion girls, women, transgender, and non-binary people of reproductive age. Yet millions of people across the world are denied the right to manage their menstrual cycle in a dignified, healthy way. Menstruation, its management, and society's response to it are linked with women's and girls' rights and gender equality. The way people in society act and think about menstruation makes a big difference in how girls and boys behave. In many cultures, the taboo of talking about menstruation has led to misconceptions and myths. In many cases, parents, teachers, and guardians share the same myths and misconceptions. In the Philippines, some girls are not supposed to leave home. In Papua New Guinea, some girls can't collect water because people think they could contaminate it. For girls in Indonesia, some are not allowed to have pineapple, soda, coconut water, ice, eggs, peanuts, bean sprouts, or sweet, sour, or spicy food. In Cambodia, some girls also can't eat certain things, like fish or sour fruit. Some families do not allow their girls to touch books or go to school, which can stop them from learning, playing with friends, and living a healthy life. To manage menstruation, women and girls need an environment that provides them with water, sanitation, and hygiene services. Lack of services to support menstrual hygiene may prevent girls from pursuing education or work, compromising their health and reducing their community participation. Entering puberty can be scary, especially if girls don't know what to expect. When beginning their period, it is important that girls can talk to a knowledgeable teacher, parent, or other trusted adult for accurate advice and support. In many countries, girls have missed school days because they were embarrassed by their period. Often, this might be due to pain, which is a common part of a girl's experience. In some cases, other students may tease and embarrass girls for having their period. Girls may also miss class due to the lack of changing rooms or clean and private toilet facilities where they can manage menstruation. Girls with disabilities have even more trouble, especially because accessible toilets are not always available. But this doesn't have to happen. Together, we can support efforts to tackle MHM challenges under water, sanitation, and hygiene, known as WASH, in school programs. For example, in Indonesia, boys had been bullying girls having their period, leading to embarrassment and sometimes absenteeism. To address this, a comic book was developed to teach boys and girls about menstruation and ways of supporting their peers. Afterwards, many boys began reporting bullying to teachers, helping make schools safer for menstruating classmates. In Lao PDR, many girls did not receive information about menstruation before their first period. To better inform girls, teams of puberty educators held workshops at schools around the country. These workshops helped develop resources such as menstruation calendars and information about sanitary materials, teaching girls about puberty in a fun and friendly way. In Mongolia, girls' bathrooms were created using shipping containers, which include insulation and flooring to protect girls from cold weather. UNICEF also assisted the Mongolian government in a program to support research and pilot ways to help girls have safe and sanitary menstrual hygiene. In Papua New Guinea, many girls live at or below the poverty line and do not attend school while on their periods because they don't always have what they need to stay active. In response, a project created a reusable sanitary pad that girls and women can use for a year. These are made in Papua New Guinea so that they are affordable. The government also published leaflets explaining menstruation, pregnancy, and additional information aimed at keeping girls and women in rural areas healthy. In Indonesia and Mongolia, 400 girls co-created the Aki app to help girls track and manage their period. Girls help determine how the app looks and works. It features protects the privacy of girls who share phones or have poor connectivity. With the Aki app, which can be used anywhere in the world, girls have a tool created by girls so that they always feel informed and in control of their period. Despite all the progress, challenges still exist. In most countries, there is a need for more and higher quality evidence on the impact of MHM on girls' lives and the effectiveness of MHM interventions. Even where previous studies exist on MHM, data may not be available for specific subpopulations, such as remote geographical areas, girls with disabilities, or transgender people. Innovations in products and services are needed to better address girls' needs while contributing to a healthy environment and circular economy. And new sources of financing that bring together public funds with private investments will be critical to ensure that everyone is reached. UNICEF is committed to ensure access to water, sanitation, and hygiene facilities needed for girls to manage their menstrual hygiene with dignity. This video is realized with the support of many partners.